If you've ever had physiotherapy, there's a good chance your physio used their hands on you at some point, pressing, mobilizing, stretching, manipulating, and you probably felt better afterwards. But did you ever wonder, what are they actually doing? And why does it work? I am Raj from Kinesio Rehab. Manual therapy is one of the core techniques I use daily. Let me pull back the curtain. Manual therapy is an umbrella term for skilled, hands-on techniques that a physiotherapist uses to assess and treat musculoskeletal conditions. It includes several different approaches, and each does something specific. Joint mobilization is where I apply gentle, rhythmic movements to a specific joint. Imagine your shoulder joint is stiff. The capsule around it has tightened. When I mobilize it, I'm gently moving the joint surfaces in a way that you can't do yourself, oscillating back and forth at different grades of pressure. But this stretches the capsule, stimulates fluid production in the joint, and signals your nervous system to reduce the muscle guarding around that area. The result is increased range of motion and reduced pain. Soft tissue release is where I work directly on muscles, fascia, and tendons. When a muscle has been in spasm or has developed trigger points, those tight tender knots, manual pressure can release the contraction and restore normal blood flow. This is the technique that feels most like massage. But the difference is that I'm targeting specific structures based on my clinical assessment, not just working on general areas. Manipulation is the technique that sometimes produces a clicking or popping sound. This is a quick, precise movement applied to a joint that's restricted. The sound isn't bones cracking, it's a gas bubble releasing within the joint fluid. Manipulation can provide immediate relief for certain types of joint restriction, but it's not appropriate for every condition. I only use it when my assessment indicates it's both safe and beneficial. Now, here's the science behind why manual therapy works. When I apply hands-on treatment, several things happen simultaneously. At the tissue level, adhesions are broken, blood flow increases, and muscle tone reduces. At the nervous system level, manual therapy triggers what's called descending inhibition. Your brain sends signals that dial down the pain response in that area. It also reduces the activity of your sympathetic nervous system, your fight or flight system, which is often overactive in people with chronic pain. That's why patients often feel immediately better after manual therapy. It's not just mechanical, it's neurological. But here's the important caveat: manual therapy alone is rarely enough. It provides a window of reduced pain and improved mobility. And that window is where the real work happens. The exercises I prescribe, the movement retraining, the strengthening, that's what creates lasting change. Manual therapy opens the door. Exercise walks through it. If you've been curious about manual therapy, or if you've had it before and wondered what was happening, I hope that clears things up. Visit kinesiorehab.com. To learn more, or WhatsApp us at 012-934-9471 to book a session. You deserve to understand every treatment being done to your body. I'm Raj. Tomorrow, just rest it. The three most damaging words in pain treatment. See you then.